complications that people are concerned about usually take the form of three types. The most common type would be possibility of infection, which is only about 1%. But we give you antibiotics before, during, and afterwards to prevent that. Bleeding is another concern. Oftentimes, if people are on blood pressure medications, that means that they're prone to becoming hypertensive or have an elevated blood pressure, and that would lead into bleeding and bruising. So during the procedure and during the anesthetics, we try to keep the blood pressure down, give you substances that help promote clotting and prevention of bruising and bleeding. So that all helps in the recovery. Other risks are scarring. That's usually not evident right away. That's evident down the road because things have to heal, and some people are prone to scars that become thick and ropey, whereas most people are not prone to that. If there looks like that's starting to develop, we treat it medically with different injections of medications that tend to turn off the scarring. There are unique institutions that apply different other medications to the scars to prevent them, and we would use those if it looked like our standard stuff didn't work. We use a combination of other medications. But scarring is usually something that occurs usually 3 or 4 weeks down the road, and then normally people will heal with the scar fading from sort of a bright pink to a light pink to a white, and we place it in the normal creases so that it's really not visible. With a major facelift or more invasive procedures, there are changes in the sensation of the skin, which is usually temporary, and that usually all recovers. For deeper procedures that deal with involving the muscles and transferring them from one place to another, sometimes the muscles may be weaker on one side than the other, or there may be an injury to one of the nerves that control the muscles. Usually if an operation is done in a setting where you have control of the bleeding and visual observation of what areas you're working on, that doesn't usually happen. That's like 1/10 of 1%. But some people who've had previous surgeries may be at higher risk for that because their anatomy is altered.